My name is Maria Suarez Almazor. I am a professor in the Department of General Internal Medicine at the University of Texas MD Anderson Cancer Center. Our lecture today is on clinical practice guidelines. This lecture will be divided into 4 parts. First, we will have a general overview of clinical practice guidelines. Second, we will look at the process of guideline development. We will then look at how evidence is evaluated. And finally, we will look at how clinical practice guidelines are evaluated and revised. Let us begin our discussion by looking at the following scenario. Think about it as we go through the lecture. The head of the hospitalist services, in reviewing performance in the inpatient unit, notices that there were some unwarranted variations in the way diabetes was managed by the attending staff. She charges 2 of the most experienced hospitalists to come up with a plan to decrease the variation. The physicians get together and, using their many years of extensive experience, come up with a document to guide the physicians and physician assistants on the ward on diabetes care. They hope this will ensure that treatment is standardized. Is this document a clinical practice guideline? We shall answer the question as we go through the lecture. We begin the first part by looking at a general overview of clinical practice guidelines. By the end of this section, you should be able to define what clinical practice guidelines are, list the types of clinical practice guidelines, and explain the attributes of a valid evidence-based guideline. Why the need for clinical practice guidelines? Healthcare providers are confronted on a daily basis with making healthcare management decisions. Sometimes the decisions are straightforward and the choices are clear. For example, administering antibiotics to a patient with bacterial pneumonia is indisputably effective. However, in many instances, management decisions may be more complex. For instance, what antibiotics should we use? There may be varying management options, effectiveness differences, varying toxicity, and differences in patient values, preferences, or utilities. In such instances, practice guidelines may be necessary to guide healthcare decision-making. In 2011, the Institute of Medicine defined clinical practice guidelines as statements that include recommendations intended to optimize patient care. They are informed by a systematic review of evidence and an assessment of the benefits and harms of alternative care options. This definition distinguishes clinical practice guidelines from expert opinions, consensus statements, practice policies, and appropriate use criteria. It emphasizes the fact that clinical practice guidelines are based on systematic identification and synthesis of the best available scientific evidence and takes into account both benefits and harms. When properly applied, clinical practice guidelines have the potential to reduce inappropriate practice variation. Note that not all variations in practice may be inappropriate. In certain situations, variations in practice may be unavoidable, as in situations where resources vary. In other words, the use of clinical practice guidelines may not be able to address all instances of variations in practice. A properly applied clinical practice guideline has the potential to enhance translation of research into practice. Busy clinicians may not be abreast of all of the new developments in an area of practice. Clinical practice guidelines find the latest knowledge, evidence, and synthesize the information into usable guidelines for the use of clinicians. Finally, a properly applied clinical practice guideline has the potential to improve healthcare quality and safety by making use of the best evidence available. To achieve its ultimate goal of improving healthcare outcomes, clinical practice guidelines can guide decision-making based on evidence that considers care outcomes of alternative strategies, can provide a basis for measuring, evaluating, and improving provider performance and quality of care. When care is standardized, it is possible to assess whether or not the proper care was provided, how often the set standard was met, and take the necessary actions to improve care. Clinical practice guidelines can contribute to support appropriate resolution of malpractice claims by considering guideline recommendations as standard of care. They can also contribute to the development of clinical decision support systems and other decision aids. They may be used in educating healthcare providers and other stakeholders about best healthcare practices, and they can assist policymakers in the allocation of healthcare resources. In summary, guidelines are a tool for applying evidence to practice, serving as a guide to best practices. They provide a framework for clinician decision-making and a benchmark for evaluating performance. Clinical practice guidelines may be used at various points in the care continuum. Firstly, clinical practice guidelines may be developed to guide screening and primary prevention. For example, the American Urological Association's guideline on prostate cancer screening. Guidelines may also be developed to guide diagnosis. For example, the American College of Rheumatology guideline on diagnosing rheumatoid arthritis. Guidelines may cover treatment and management of conditions, for instance, management of community-acquired pneumonia. Finally, they may be issued to guide rehabilitation programs, such as the Guidelines for Adult Stroke Rehabilitation and Recovery by the American Heart Association. The Institute of Medicine has listed 8 recommended attributes that a clinical practice guideline should have. Let's look at each one at a time. The first desirable attribute is validity. By validity, we mean that when the guideline is followed as prescribed, the projected outcomes and costs will be attained. The second desirable attribute is that the guideline must be reliable and reproducible. If another set of experts are given the same evidence and they use the same methods for guideline development, they should be able to come out with very similar recommendations. Given the same circumstances, the guideline should be interpreted and applied consistently by the users. So, for the previous example involving diabetes care, 2 different patients with similar clinical findings should be receiving similar treatment, although they may be seen by different care providers. The third attribute is clinical applicability. This means the guideline must clearly define which population groups the recommendations apply to, as supported by the available evidence or expert judgment. Number 4 is clinical flexibility. This means the guideline must offer a means of accommodating different consumer values and preferences. The fifth attribute is clarity. Practice guidelines should give clear and unambiguous recommendations, presenting different options of management clearly and using logical, easy-to-follow steps. The sixth attribute requires that guidelines be developed through a multidisciplinary approach. All relevant stakeholders must be involved in their conception and development. This should include a broad range of clinicians involved in the care of the patients targeted by the guidelines, allied health professionals, methodologists, patients and consumers at large, and even policymakers when appropriate. The seventh attribute is that the guidelines must have a schedule for updates. Since a guideline must be based on the best available evidence, it needs to be reviewed regularly and at specified intervals in order to incorporate any new evidence. And this schedule must be clearly stated as part of the guideline. Finally, a guideline must have proper documentation of the procedures followed in its development, the participants involved, the evidence used, the assumptions and rationale behind the decisions for recommendations, and the analytic methods employed. This lends transparency to the development process. Many organizations develop clinical practice guidelines. Guidelines that met a certain set of quality criteria are included in a national database called the National Guideline Clearinghouses. This is a database of publicly available evidence-based clinical practice guidelines maintained by the Agency for Healthcare Research and Quality. Its essence is to promote widespread access to clinical practice guidelines and promote their dissemination, implementation, and use to inform healthcare decisions. The National Guideline Clearinghouse also provides structured, standardized summaries containing information about the guidelines included in its database. The National Guideline Clearinghouse has strict criteria that guidelines must meet in order to be included in the database. For clinical practice guidelines to make it into the National Guideline Clearinghouse, they must contain systematically developed recommendations, strategies, or other information that can assist healthcare decision-making in specific clinical circumstances. The guideline must have been produced under the auspices of a relevant professional organization, such as a medical specialty society, a government agency, or healthcare organization. The development process of the guideline must have included a verifiable, systematic literature search and review of existing evidence published in peer-reviewed journals. It must contain an assessment of benefits and harms of recommended care and its alternatives. The full text must be available in English to the public, either for free or for a fee. And lastly, the guideline must be the most recent version available. There should be evidence that the guideline must have been developed, reviewed, or revised within the past 5 years. This is the end of this part, and we will now have a short quiz.